Next up, I'm really excited about this part. We're joined by Wylie Edwards. He's the Technical Operations Manager at Gippsland Health Alliance. Thanks for being with us today, Wylie.
No worries, Jordan. Thanks for having me.
Awesome, no problem at all. Now, I know obviously there's a few emergencies going on in your area, and actually the work of Gippsland Health is mission critical. And your organisation provides support for 5 large hospitals, other outpatient clinics. I think there's about 10,000 staff across the region. And pretty much every time a lot of those staff need to access, a system, they're doing it because someone needs that for health or other things, which obviously raises the bar in terms of, the experience that they need to have. So there's not much room for a poor EUC experience. Can you share a little bit about your journey with Nutanix?
Yeah, sure. So we started our journey essentially as many medium to large size businesses probably do, hosting a standard kind of environment. We had a number of data centers. They were full of racks and racks of servers that took up a lot of space, consumed a lot of power. These are really, really precious resources, especially in a hospital healthcare setting. So we were very frustrated. We tried some hyperconverged technologies previously. We weren't particularly happy with them. They still needed a lot of specialist skills and knowledge. You still needed networking people, you needed server people, Windows OS people, all sorts of technical specialist type roles to support that environment. And so we ended up centralizing everything in the Nutanix environment, hosting it on a mix of VMware and AHV, with our Citrix environment sitting in AHV. That enabled us with a very, very small team to support 800 to 1,000 concurrent users, maybe a bit more on any given day, of our key clinical applications. And that application is really, really critical to patient care. It has to work. If a doctor or a nurse or someone cannot access that application, they can't treat the patient. And so patients' lives depend on this environment being functional and working. And with Nutanix and Citrix combo, we've been able to achieve that level of resilience in our service to the public.
Now, you do have a pretty small team. What's the impact been of moving towards Nutanix for the team and also for the end users?
Yeah, look, one of the key drivers for this, because in public health, we don't have a lot of money, and we knew we had to reduce management complexity of the environment because we weren't going to get money for more staff. So the impact on our team is that I have a team of 3 staff, literally 3 technical staff that support over 10,000 staff across southeastern Victoria. We have 600 odd virtual servers sitting in our environment that these staff manage. And in doing that, we've also had other flow-on effects as well. So our clinicians, for instance, we implemented a tap-on, tap-off swipe card log-on system with our environment. And it meant that clinicians, instead of sitting there typing their password in to approve medication and to do all the tasks that they need to do in the environment all day, they just use that system, and it's very, very quick, and it's saving them literally hours and hours per month that they can dedicate. Instead of worrying about and fighting with technology, they're able to put their focus into treating patients. One of the other key benefits too, especially in recent times that we've had, is to do with our security posture and being able to patch what is really a big environment with very few staff, and being able to, when patches are released, and we're able to almost immediately patch the environment with 0 downtime for end users. There's no interference to patient care or anything like that. That's pretty amazing from my perspective, to be able to do that with a very, very small workforce.
Yeah, it sounds like an amazing story. I mean, reducing complexity, obviously a very small number of teams, 600 VMs with only 3 staff, and then obviously that idea of no interruptions as you're maintaining your security posture. So thinking about other people who are in the same position as you, what advice would you share based on your experiences and any lessons you've learned?
Look, for the best advice I can give is that if you're considering a hyper-converged infrastructure, and in particular Nutanix, just do it. There are a lot of different hyper-converged environments out there. They make a lot of claims and promises that they will deliver great things and they'll be able to achieve the sorts of things that we have been able to achieve. We were only able to achieve that with Nutanix because they actually deliver on the claims and the promises that they made to us. We're able to run this really, really big infrastructure with just a handful of staff. So do your research up front, ask a lot of questions, know exactly what you're getting into, and you will be successful.
Awesome. So Wylie, and people, Brian's going to talk a little bit about people being able to do have their own experience through test drives. So that's another good way to sort of see exactly how easy it is to use Nutanix and all of the different functionality. So Wylie, thanks a lot for being with us today and sharing your story. I think it's really interesting and valuable to hear from people who are actually using the technology. So I love that, and we really wish you all the best for the year to come.
No worries. Thanks, Jordan. Thanks for having me.